Thanks for joining us today. We're really excited to have this conversation because it's the first time that we have a webinar series on public health and belonging at the Tamarack Institute. So if you joined us last week, thanks for joining us again. If it's your first time joining us for this webinar series, we are going to share some information on context so that we can all have more or less the same foundations for today's conversation. So as a reminder, today's webinar is Action and Implementation, Building Belonging into Public Health Practice. So last week, we talked a lot about belonging as a social determinant of health. This week, we are going to look into action. What does it look like to work in the context of belonging and public health? We have two fantastic speakers that I am really excited to introduce shortly. I'm Jorge. I steward our communities building belonging network at the Tamarack Institute. And I'm joining you today from the lands of the Kanien'kehá:ka Nation, very close to Tiohtià:ke, which is also known as Montreal. As we know, Turtle Island has been home since time immemorial to the ancestors of First Nations, Métis, and Inuit peoples. We recognize that in this territory, Indigenous right holders have endured historical oppression and continue to endure inequities that have largely resulted from the widespread failure of non-Indigenous treaty people to hold up their responsibilities. It is our hope and our aspiration at through the work we do at the Tamarack Institute that we can contribute towards informing and shaping our shared journey of reconciliation. We also want to acknowledge those who came here as settlers, as migrants, either in this generation or in generations past, and those who came here involuntarily, particularly as the result of the transatlantic slave trade. We want to pay tribute to those ancestors of African origin and descent. This acknowledgement is very important for us at the Tamarack Institute because it's part of our ongoing commitment to dismantling anti-Black racism that, as we all know, has resulted in several inequities for Black communities across Turtle Island. For today's conversation, we have a check-in question. In your current work, what's one action you're already using or considering to foster belonging in your community? Again, the question is, what is one action that you're already using or considering to foster belonging in your community? And we invite you to share your thoughts through the chat. Jamie, is there anything that is coming up so far?
Yeah, we're hearing someone say open space. Someone else has shared incorporating neuro-inclusive feedback. Someone else has flagged sharing circles or restorative peace circles, open mic nights, using multi-languages services. We love that. We love a linguistically inclusive environment. Developing a monitoring framework. There's a lot more coming in now. Promoting more engagement with people who are affected by government policies, doing local reconnection groups that have maps and listings of free and affordable local events. There's a lot of great ideas here. Integrating social health concepts into built environment strategies, engagement with equity denied and under-recognized groups. Someone has shared an example from environmental defense called Reconnect Waterloo Region. Yeah, so there's a lot of great ideas here, Jorge.
That's wonderful. Thank you for sharing, Jamie. And thanks to each of you for contributing to this sense-making process. As I have mentioned since last week, this webinar series is part of our ongoing efforts towards shaping the call for a Canada-wide strategy for belonging. So every piece of feedback that you share with us is truly important. It contributes to this collective thinking process, and we'll take it into consideration as we continue the harvesting on insights for the 2025 SharePack exercise. So in 2024, we engaged in 8 workshops and webinars. We also engaged with 13 Circle of Actions communities who joined Tamarack's first cohort on building belonging. We also hosted 5 community conversations and 3 in-person conversations. And we're thankful to the over 1,000 individuals who signed the pledge for a Canada-wide strategy for belonging. These ongoing efforts have been so important in shaping this movement, in informing the next steps for us at the Tamarack Institute and in collaboration with our partners. We will be sharing with you shortly next month a report that will reflect on all these takeaways from all these engagement conversations. And we're going to be doing a similar exercise after the end of 2025. So before we start with today's topic, this is what I meant when it comes to solid foundations. Here are some of the ideas that we discussed last week. The call for a strategy for belonging brings together different sectors. I want to highlight specifically the healthcare sector, community health practitioners who have been very supportive of this work. We see growing interest, growing energy in this movement, and we thank you for the insights and the resources that you continue to share with us. In particular, I want to thank the speakers that are joining us today. We have representation from across Turtle Island. We're conscious that some provinces and territories, some provinces are more represented than others. So moving forward, we want to have more equitable representation, geographically speaking. And people often ask us, what is the strategy for belonging all about? What's the aspiration? Essentially, we want to bring together cross-sector collaboration to share resources and expertise. We want to shape the call for a strategy that centers everyone's voices. We want to shift power to residents as co-creators of change and enable population-level change by encouraging municipalities to commit towards having a plan for building belonging and by increasing the reported sense of belonging among individuals. There are three essential conditions that have guided these efforts towards making belonging a policy priority and outcome. The first one is that it's important to steward power redistribution and democratic competences. This means that governments, organizations, and institutions have a role to play as facilitators, amplifiers, and connectors. And in assuming these roles, it's critical to address power imbalances. Another condition that we have observed is the need to find common ground, especially during these polarized times. This means that reaching our goals for equity and accessibility requires that we meet people where they're at, understanding that individuals have unique skills and talents to bring. It's not a yes or, it's yes and. And this requires understanding and welcoming that we as human beings are complex individuals. We all carry multiple identities and sometimes conflicting identities. The other essential condition that we have observed is that it's important to inspire leadership. We need a new generation of leadership right now. The creation of a future of belonging relies on our collective ability to inspire leadership in one another. We must build partnerships that shift power and sustain a vision of futures that are equitable, regenerative, and trust-centered. Last week, we also spoke about 9 key themes that we identified through our 2024 conversations, which will be mentioned in the report. I encourage you to listen to the recording, watch the recording from last week's webinar to take a look at those 9 themes. In the spirit of time, we won't be presenting them today, but the information is there and will be available next month through the report. This year, we have exciting engagement opportunities for you. We have the Strategy for Belonging Working Group that is starting on April 29th. There will be 4 sessions. The first one will be taking a look at leadership. What does leadership look like for building belonging? What are the skills that are needed for that? We also have 3 webinar series. We're wrapping up today the one on public health. We'll have one in June on climate action and belonging, recognizing the connection between climate inequities and exclusion and othering. And before the end of the year, we'll have one on ending poverty and belonging. We will host 3 conversations with municipalities, so please stay tuned for more information on that. And we have, as always, 3 open communities of practice. Anyone can join. We welcome all practitioners, and they focus on neighborhood learning, specifically social infrastructure in neighborhoods, community safety, and emergency preparedness. Right now, as I'm speaking, our team is working really hard, mobilizing in all these different directions. We're having an emergency preparedness session at the same time. We're also having a cohort session right now, and we're having this webinar. So as you can see, there's lots of activities going on. As a reminder, the Strategy for Belonging Working Group is starting on April 29th. Our first session, as I mentioned, is on cultivating belonging, a foundation for leadership. This is a space for you to speak. We will only be holding the space, but it's really for you to help shape the conversation. And finally, before I introduce the speakers, I just want to celebrate their work because they are contributing immensely to the strategy for belonging as part of the Circle of Actions. This year, we're thrilled to host for the second time the Circle of Actions cohort that is contributing to help communities develop plans and interventions for belonging. We have these 13 trailblazers from British Columbia to Newfoundland and Labrador. The team that is joining us today is the Tri-Cities Healthier Communities Partnership Table, and their focus areas are on well-being, community resilience, equity, and more. And the theme that we have for this year on the strategy for belonging is transforming skills and knowledge. Last year, we did a lot of effort on raising awareness and will that got us to the over 1,000 individuals who are now supporting this pledge. And now we want to really deepen the conversations on the skills and knowledge that are required to do this work effectively. We have been telling stories. A couple of days ago during Refugee Rights Days, we also featured the work of two Circle of Actions participants, one in Newfoundland and the other one in Newfoundland and Labrador and the other one in Ontario, that they're working with newcomers to build belonging and address inequities in places. And without further ado, I'll pass it over to you, Shaina and Abigail. Sorry for the long intro. I just thought this was really helpful context for the audience to understand where we're coming from and why it's so exciting that you're joining us today for our webinar on action and implementation. So I'll stop sharing my screen now, and I'm going to pass it over to you, Shaina.
Thank you so much, Jorge. That was a great introduction. Yeah, thank you so much for inviting us to speak today. It's such a pleasure to work with Tamarack, and we're really excited to share about the Tri-Cities Intergenerational Belonging Project. My name is Shaina Schafers, and I'm a community health specialist at Fraser Health Authority, working in the Tri-Cities. And my role is dedicated to supporting community-based health initiatives and healthy public policy, primarily at the municipal level. And in terms of this project, I'm also the chair of the subcommittee on social connectedness that's leading the Intergenerational Belonging Project. So I've been coordinating the development of it.
Hi, everyone. My name is Abigail Cameron. My pronouns are she and her, and I'm the Associate Director of Strategic Initiatives and Development at Success. And in that role, I oversee the Tri-Cities Local Immigration Partnership. One of the key priorities for the Local Immigration Partnership is around social and civic inclusion of newcomers. And so we're very delighted to be supporting and co-leading this project along with other colleagues, like the Tri-Cities Literacy Committee, as well as Fraser Health, because we believe that, in working together, we really can make some really great strides in fostering belonging.
Thanks, Abigail. I also wanted to note that this is a new project. So today we'll be presenting on the context that has led to the project's creation and our vision, goals, and ideas for activities that we plan to do and that we've kind of just started. Thank you also, Jorge, for the beautiful territorial acknowledgement and African ancestry acknowledgement. We'd also like to acknowledge that the Intergenerational Belonging Project is being carried out on the traditional, ancestral, and unceded shared territories of the Katzie, Coquitlam, Musqueam, Squamish, and Tsleil-Waututh First Nations. And I'm calling in today from the shared territories of the Musqueam, Squamish, and Tsleil-Waututh. And on the topic of belonging and health, I also wanted to share a really beautiful word from the Métis language, Michif, which is Mamawik Kayak, and it means healing together, which I think the fact that they're together in one word, I just kind of keep coming back to reflecting on this, thinking about belonging and health and how we really need each other to heal. And yeah, we need to heal in community.
That's beautiful, Shaina. Thank you so much for sharing that. And I'm joining you from the unceded territory of the Coquitlam First Nation. As a settler who came to Canada in my teen years, I recognize how these lands have nurtured me and my family, and I acknowledge my own privileges and commit to advancing truth and reconciliation, both in my personal and work life. So as we move on, I'm not sure if most of you are familiar with the Tri-Cities. We are a region about 30 kilometers northeast of the city of Vancouver. The region is comprised of 5 municipalities, with Coquitlam, Port Coquitlam, and Port Moody as the 3 larger communities, and the villages of Belcarra and Anmore are included in that Tri-Cities region. According to Census 2021, it has a population of over 241,000, and 41% of its residents were born outside of Canada. We are a diverse community surrounded by mountains and water and amazing, beautiful people.
Thank you. So I'm going to start us off with a very brief introduction to the field of public health, which many of you are probably familiar with. But as you can see in the image, supporting wellness through a public health approach really includes working across different sectors like government, school districts, health sector, transportation, because it's all about addressing the social and structural determinants of health, recognizing that population health is impacted by factors like income, education, housing, and more, as well as the wider set of forces and systems shaping the conditions of daily life. And I know in last week's webinar, they did an amazing job of really outlining this and how it connects to belonging. And then, of course, how public health approaches also strive to promote health equity with the aim for everyone to have a fair and just opportunity to be healthy. And we'll be speaking on this a little bit more throughout the presentation. So it's a very broad and interdisciplinary field, which is even better represented by this following image from the Yale School of Public Health. I think it's a pretty great example. They've tried to kind of map out all the complexities of public health studies that inform the evidence base of the discipline. But thinking about the topic of today's webinar is about action. It also helps to outline that, or to kind of demonstrate that taking action in public health is also really complex and requires a coordinated and intersectoral approach, which Abigail will speak to now.
Thanks, Shaina. As you saw in that image, or in the previous image, there are so many amazing factors and components that come into play when we're talking about fostering belonging in the public health, within a public health approach. And so our project uses the collective impact framework, which recognizes that across different sectors, there are amazing initiatives that are taking place. And by using a collective impact framework, we're able to identify those key actors in the community and work together to reach a common goal of improving belonging in our communities. And the collective impact approach was first outlined in 2011 in the Stanford Social Innovation Review article by John Kania and Mark Kramer. And it has since evolved using continuous improvement processes and feedback. The core components of collective impact include a common agenda. So really understanding and building a common vision and approach to addressing a specific social problem. It also includes a shared measurement system to identify common metrics that track progress and success. And that allows for accountability and reflection on shared interest. Through that, we are able to then identify and develop mutually reinforcing activities that are coordinated so that we can really leverage each other's strengths and resources, especially during a time when there's, transitions, whether that's through funding levels or different, factors that might impact resources. And so how do we leverage these resources together to really strengthen our reach, our scope, and certainly our outcomes? And throughout all of that, it's really important to have that continuous communication. As you know, that continuous communication really fosters trust, collaboration, and also it helps us motivate one another in the collective by creating those continuous communication processes, but also continuous improvement because we're able to learn from one another and share different perspectives. And of course, there's also the Backbone Support organization, which helps facilitate all of that collaboration, manage data collection, and ensure effective coordination among the partners. And we are delighted to be working with the Tamarack Institute to guide us through this framework during our project.
So we wanted to share about kind of the structure that's guiding our collective action or collective impact approach for this project. So Fraser Health Authority actually began working with municipalities in around 2008 to start taking more upstream action in partnership with the local governments. And then in 2012, under the BC Healthy Communities Initiative, health authorities were actually mandated to work in partnership with municipalities to build healthier communities. So that's across the province. And in our region in Fraser Health, we do have local HCPs set up across, and they meet quarterly, again, to facilitate collective action, to promote health and well-being, reduce chronic disease in each community through this population health promotion and evidence-informed upstream action that we've been talking about. Each table might be a little bit different, but most are co-chaired by the Fraser Health Medical Health Officer and a city councillor. And involve a variety of partners across sectors. And that's the model that we currently have in the Tri-Cities. So just quickly to show some of the folks that might be represented at or representing organizations at the Healthier Communities Partnership table, you can see we have municipal councillors and staff, the Fraser Health Authority, including different members from our wellness team and the Division of Family Practice, also representing the health sector. We have a number of different community committees and coalitions representing youth, seniors, immigrants, newcomers, regional organizations like the school district, and also community-based organizations. So we all come together on a quarterly basis and see how we can collaborate to promote healthier communities. A little bit more specifically, so the Tri-Cities HCP did some strategic priority setting in 2024. And mental wellness and social connectedness was one of the 4 immediately actionable priority areas. So the table really rated this as an important priority. So as a result of that, we created a subcommittee on social connectedness that is now leading the Intergenerational Belonging Project. So you're starting to see the kind of where we're situated within this larger table. So our subcommittee members are from, the same organizations that sit at the HCP table, but might hold different portfolios or be in different roles. So for example, though some of the folks that are on this subcommittee include municipal recreation coordinators with portfolios that cover seniors and youth. We have one city social planner, the local immigration partnership, the local library, and a few other people all coming together to work on the Intergenerational Belonging Project. And then we're connected to and report back to the larger HCP table. We also know that part 1 of this webinar provided an excellent overview of belonging as a determinant of health, but we just wanted to mention, for those of you maybe who weren't able to attend, some context, but really that loneliness, a meta-analysis in 2010 found that loneliness is comparable to smoking up to 15 cigarettes a day. And in general, research shows poorer health outcomes associated with social isolation and loneliness. We've also done a little bit of digging into local baseline data from the Tri-Cities and seen a need to support child, youth, and older adult social connectedness. So for those reasons, we've decided to focus on an intergenerational belonging approach. Also, because we know that intergenerational connections are a powerful tool for strengthening community resilience. And also that age-integrated communities are healthier communities. So on that note, the vision for the Intergenerational Belonging Project is to connect older adults with children and youth in meaningful exchanges to foster relationships that are reciprocal, protective, and have lasting impacts on community resilience, health, and wellness.
And of course, one of the things that's really important for us, given our diversity in our communities, is the commitment to center equity denied groups and promote accessibility for folks who are isolated. From research and community consultations, we know that equity denied communities face greater barriers to belonging and civic participation. So targeted interventions are needed. In order to do this meaningfully, our project embeds that commitment to center the voices of equity-deserving groups by engaging youth and seniors in the subcommittee. We're also looking at all the different intersections of identities in terms of, engaging community members. And so things like hosting community engagement sessions to consult and collaborate with communities on their needs, and to leverage existing community advisory tables to co-design and promote accessibility for folks who are isolated. Some of the things that we really want to see advances around how do we reduce those participation barriers that may be related to cost, mobility, language, social marginalization, and other factors. And by leveraging those existing community tables, we're able to then engage the voices of impacted communities throughout the project. And our hope is that we're able to really reach those that are at higher risk of social isolation. And so the first goal of our project is to create connections and synergies between existing intergenerational belonging interventions. As mentioned earlier, there's a lot of different things that are already happening in our community. And so one of the activities that we're hoping to do is to do an asset mapping to really identify the opportunities so that we can collectively support these initiatives. Some examples of the things that we know already exist is in one of our, in Coquitlam Public Library, they have a Holiday Hello program, which engages youth to create holiday cards for seniors who are at risk of isolation, with many living in assisted living and long-term care facilities. And through their home delivery programs, they're also able to deliver these cards along with any books that they might have to the homes of those who are at risk of that isolation. And last year, 3,000 cards were delivered to over 735 seniors in Coquitlam, which was amazing. And we also have the Tri-City Seniors Action Society that has been delivering various community activities for seniors, including social events, elder abuse awareness campaigns, and many more. And so by connecting all of these different initiatives and programs together, we're really able to understand those key players in the community and better strengthen each other's capacities and resources to work together. The executive director of the Tri-Cities Seniors Action Team recently received a New Horizons grant, and he was mentioning that, well, I was going to do this all by myself, but then knowing that this project is together, then that makes it a little bit easier to reach others. So really using that asset-based community development approach, we're able to strengthen those existing resources and in the community, and also hope to avoid duplication. So how will we create these connections and synergies? Well, we're hoping to really advance through that collaboration spectrum. We're privileged in the Tri-Cities in that there's a lot of cooperation, and we already have some existing coordination tables that are in place, which really strengthens, our approach. And we're hoping that we could move through the collaboration spectrum towards integration a little bit more. And so how we're going to do that through the project is to have monthly subcommittee meetings, so that will enable us to really identify opportunities for collaboration, share priorities, trends, and how we can support each other. I mentioned the ABCD, or the asset-based community development approach, where we will be identifying those assets and engage community members on how they define belonging and their aspirations for belonging, so that we can also identify and hopefully address gaps and needs. Our hope is that those involved in the project will be able to advance through the collaboration spectrum towards integration. Yeah, so I'll give you an example of one of the things we're hoping to also leverage is that the Tri-Cities Local Immigration Partnership will be hosting some community consultations to engage racialized immigrant youth and seniors on their definition of belonging and what gaps and needs they might have. And so our hope is to collaborate with some of the key players in the subcommittee to identify, community events where we can reach more racialized immigrants who may not be connected to settlement programs. And so our hope is really to widen our reach of folks and get those diverse perspectives in there. And then I will move on to goal number 2, which is around increasing opportunities for community members to lead and participate in intergenerational exchanges. To support this goal, we have some ideas for activities that include working with community members to lead new initiatives. So for example, by bringing folks together, supporting with grant applications for funding, supporting applications to neighborhood grants as well. We're also hoping to incorporate intergenerational activities into municipal and community programming. We have phenomenal partners with the municipal recreation programs who are looking at, different ideas to put into their programming that really builds those strong intergenerational bonds. And then the final activity, or what we hope to be the final activity, would be identifying more third spaces and suggesting intentional changes to the built environment. We know the importance of third spaces, in community and in fostering belonging. And we've heard all the different examples of daycares located in assisted living facilities. We've also talked about some programming for older adults and youth centers, or youth programming at seniors recreation centers. And so those are some of the ways that we're hoping to really build more of, those opportunities to really support folks in intergenerational exchanges. And we're very inspired by this amazing program that's called iGen, which is out of Saskatoon. And the grade 6 class spends their classes in a long-term care home. So it's not just a visit. They actually spend the learning day, the school day, in the long-term care home. They're learning about life lessons with their connections with the residents of the long-term care home. Seniors are also enriched by the youth's presence. And in this photo, one of the residents was a former teacher who would then lead some of their reading activities with the students, which was amazing. So we're inspired by that. And our project also recognizes the importance of the third space as vital to increasing sense of belonging. One of our partners with the city of Port Moody is looking at transforming a shared space between older adults and youth with intentional programs to create meaningful interactions. And at our first subcommittee meeting, we also discussed how there may be an opportunity to collaborate with Success's digital literacy project, which could potentially collaborate with the city. Success has the digital literacy project that provides training for folks to become digital literacy ambassadors. And we're hoping that the youth could receive that training and they can then support older adults on different digital literacy topics, which can really support that intentional programming and meaningful exchange as well.
Thank you. I also wanted to share an example of a local project in the Tri-Cities that's been really inspiring for us on this project, which is called Real Acts of Caring, which they have named RAC at Porter Elementary. So RAC is a program out of Porter Elementary in Coquitlam, and it's dedicated to promoting care and kindness by doing acts of kindness in their classrooms, school, and greater community without expecting anything in return. And in 2020, during the onset of COVID, the students wanted to address isolation of seniors in the community and created the Intergenerational Integrities Program to bridge the gap between youth and seniors, and started organizing online meetings to connect and share stories. So really important, RAC is led by the students. So they make up the steering committee, they plan the activities, give presentations, and come up with the new ideas for programming. And of course, they are supported by an amazing school counselor who's been doing this for almost 20 years. Her name's Harriet Chang. And Harriet has documented and created a manual for this program, which has documented some of the effects and connected it to research showing that this type of initiative can really increase a sense of belonging, have a reduction in bullying behavior, decrease depression and anxiety, and other amazing impacts that Harriet kind of also shared anecdotally with me, which left an impact on me in terms of what this program has been able to create in the school and community. And one of my favorite aspects of this example is how it shows how bringing people together to work on something they care about and that positively impacts their community can create momentum for civic engagement and advocacy. So in the case of RAC, they realized that, they not only care about doing kind things for other human beings, but also wanted to do a real act of caring for the environment. So they began advocating by writing letters and delegations to councils about banning single-use plastic. And so we're taking examples like this for inspiration to guide our project, especially around that community-led piece, seeing how they can have impacts on the interpersonal level, of course, at the community level, and the systems and social change level. And we can see how this project has led to increased social connectedness and belonging. Child and youth civic engagement has been embedded throughout the entire thing, and you can see how it's really, gained momentum. And of course, in this particular example, environmental protection. So on the note of, we can see how all of this is also connected to health and well-being. And thinking about policy and systems change and how it's all connected, that leads us to our final goal for now, which is to promote belonging as a priority for municipal strategies, plans, and policies. So some of the activities we plan to do to reach this goal, again, is we're centering community engagement really to hear from residents about their aspirations for belonging and be able to act as a sort of conduit, or arrange for their voice to really be heard at the like with city councilors and others that we are connected to. We'd also like to do a deeper dive into analyzing local data related to social connectedness for information about needs and equity concerns. We plan to research and share evidence-based strategies for promoting belonging at the municipal level. And we'll also regularly be reporting back to the HCP, our Healthier Communities Partnership table, because also, if we're in agreement that belonging is a key determinant of health, and we have our social connectedness as a strategic priority for the table, the collective action piece is for all of the member organizations to identify how each of us can promote belonging within our scope and initiatives. And some of the resources that we've identified so far that should be able to support us, particularly with this goal number 3, are on the slide here. So the first one is Child and Youth Mental Wellbeing Guides for Municipal Government. So this was created by BC Healthy Communities in partnership with Vancouver Coastal Health, and they've outlined 4 protective factors for children and youth that municipal governments can impact through their policies, plans, priorities. And there's some really great information in there. We're also looking, to examples from elsewhere. There's the municipal strategy against loneliness created by Barcelona. It's a 10-year municipal strategy that they created in response to a survey that found that 70,000 people across all age groups in the city felt lonely often or very often. So some of the examples some of the actions in the plan include a loneliness awareness campaign to conduct an analysis of loneliness among people with disabilities, creating new community spaces, and many more in the strategy that will kind of support the direction of the municipality. The third one is the new national guidelines for social connection, recently published by the Canadian Alliance for Social Connection. And finally, a huge support to our project has been participating in the Tamarack Institute's Circle of Action cohort that Jorge had introduced, which supports local belonging projects with mentorship and coaching and participating in the National Belonging Strategy. So these are just a few resources. We'd be happy to hear of other ones if you know of any, but we plan to kind of really look into this and learn as much as we can as we move forward.
Thanks, Shaina. And as a collective, we aspire to strengthen and connect these initiatives to create, a more effective, sustainable, and accessible network of intergenerational belonging interventions. You'll see here some of the outcomes that we're hoping to achieve. We really want to expand the opportunities for intergenerational exchange that encourages diverse participation, transformations to built environment that lead to improved community and civic participation and involvement, and to build political and institutional momentum that embeds belonging in policy and planning for long-term societal and economic benefits. We really want to emphasize the power of the collective approach by engaging diverse community partners. We'd like to really connect with one another to enhance alignment and identify scaling, sustainability, and different policies that can impact the sense of belonging in our community. And so we're still in the early days of the project, but our hope is that after we do the asset mapping, we'll then be able to create an evaluation framework on these outcomes. Then it's supported by metrics that we all as subcommittee partners agree on. And and so these are some of the expected outcomes for our project.
Okay, I think that's it from us. So we just wanted to say thank you again for hearing about our project, and look forward to discussing this more with all of you.
Thank you so much, Shaina and Abigail. What an inspiring project. I really appreciate how you're working at multiple levels of the system and how intentional you are also in creating those connections with residents and ensuring that there's coherence in the approach that you are developing and also how you work in community. Jamie, I'm conscious that you have been looking at some of the questions from the chat, so I'll pass it over to you. And I also have a question for the speakers, but I'll hold on to that one.
Thanks, Jorge. So looking at the Q&A box where other folks are welcome to add questions if they would like. One is coming from Larissa, who is asking, is there more upstream work being done to strengthen social connectedness at a systems or policy level? Specifically, what role is public health playing in shaping those upstream efforts? Abigail or Shaina, do either of you want to take that on?
Sorry, can you say the beginning of the question again? So is there more?
Of course.
Yeah,
so
thanks.
Is there more upstream work being done to strengthen social connectedness at a systems or policy level? So again, it's like thinking maybe a bit above the Fraser Health, public health unit. Is there anything that's happening at a higher level than that you've seen, specifically on social connectedness?
Yeah, thank you so much. That makes sense. Yeah, we've talked about this and we really hope to do a closer look into kind of locally what's going on at the municipal level in terms of, age-friendly strategies and we know that, in the municipalities we work with, they all have their official community plans, right? Their OCPs that are their long-term strategies kind of guiding the work of the city. So we also know that there's some alignment within those plans to social connection. And yeah, so we're planning on kind of doing more of a deep dive into that. One of the examples I can share recently out of Port Moody is that the city created social and well-being guidelines for new housing developments. So I don't know the exact details. But basically, if you're going to develop new housing in Port Moody, if you go, there's a checklist that you can go through to incorporate changes to the built environment that lead to more social connection among the residents of those buildings. And then the developers would receive some kind of benefit in doing that. So we know that there's some examples of those things going on at the municipal level, and we definitely plan to kind of identify those and see how we can connect and support where there's already momentum. And just finally, in the Tri-Cities, one kind of interesting thing that happens is, if one city kind of takes leadership and creates something and we see that there's support for it and it's working well, then something like the Healthier Communities Partnership Table, we're able to kind of bring that back to the table, highlight it, share it to the other municipalities who might consider also doing the same thing. So it's a bit more complex working with the different municipalities, but at the same time we get we get ideas from all of them. And there are a few city councilors that are interested and supportive of this work that we've already met with. So we'll be working more closely with them.
If I can also add, there is the Strategy for Belonging Working Group. So we have a session on September 23rd, and it's specifically focused on policy. So I would encourage you to join that session, Larissa, if you're interested. And next month, we're going to have the report that has also some design recommendations on the Strategy for Belonging, so that we can embed belonging into our work and make it a policy priority. So there definitely will be opportunities for you to learn more about some thinking, some processes, and also opportunities for you to contribute to that. And anyone else who wants to join.
Thanks, Jorge. So what I was hearing from you, Shaina, is that you're seeing more of like lateral collaboration between municipalities rather than necessarily upstream at a perhaps a provincial level. Is that accurate?
I think it's more that I'm just more familiar with what's going on at the municipal level, aside from the resources that I shared in terms of the new national guidelines. Yeah, so there might be something and I would love to see them, but those are kind of the things that I'm more familiar with.
That's totally okay. I appreciate that. Thank you. We had another question, and maybe Jorge might have more to say about this, which was what public health practices to build belonging might you advise for rural settings or small towns? I'm thinking of when we were talking to Pema last week, and she was flagging that there are like belonging has an implication in so many well-being strategies. So there's different types of public health interventions, but Jorge, in the work that you've been doing, have you seen any strategies that would be better suited for a rural or small town setting?
From based on the work we have been doing so far, I would suggest starting with an ABCD lens as a way to support existing efforts that are advancing connection. Because why am I specifically thinking about ABCD for small and rural communities? Because too often when we have conversations with small communities, and this is also the reality for bigger cities, but small and mid-sized cities tend to get less attention from funders and policymakers sometimes, unfortunately. Too often the conversation goes to, we don't have funding, we don't have resources, we don't have capacity to do this work. Well, there is already great work happening in place. It's just that the work is not often connected. So just start from a strengths-based approach, map out what are the assets that your community has, and then how can you better connect them to each other and make it a win-win situation for everyone in the community. which reminds me a lot of the framework that you both presented, Abigail and Shaina.
Thanks for that, Jorge. I also just dropped an article in the chat from Heather Keem, who is our resident expert on asset-based community development, that's titled 5 Steps for Implementing ABCD in Rural Communities. That might have some additional information. But yeah, for us, it's very much an ABCD approach.
I can also share one thing about that.
Please do.
Sure. Yeah. So in the Fraser Valley, so Fraser Health region, there are some rural communities more to the east, and because there's data being collected about health indicators, health outcomes, it was pretty obvious that there was inequities in terms of health outcomes in the rural communities had lower health outcomes. So within the Fraser Health Authority, they actually created a new, and I might not have the details totally right, but a new funding stream essentially to divert more resources to the Hope region. And there's a community grants program that's what the funding goes towards. So community members themselves, come up with their ideas for promoting health within the community, and there's a steering committee there. So there are some examples of resources coming from health authorities to kind of address the inequities in rural areas.
That's great, thank you. The last question I'll flag, and this is one that was in the Q&A box but has already been answered, but just so it's on the record for everybody, somebody had asked if there's specific data or statistics about who is most likely to be experiencing loneliness. And for that, we wanted to recommend, again, another article from our colleague Heather Keem called Community as the Superhero, where she specifically unpacks a few of those statistics, both from the United States Surgeon General report on loneliness that came out in the past few years, and also some Canada-specific data. That is also shared in the chat and will be included in the follow-up email that goes out to all registrants.
If you join the Strategy for Belonging working group, we will usually start the conversations with some facts. What is the data telling us when it comes to belonging, loneliness, polarization, social isolation, and this is going to help shed light on the inequities that communities are dealing with.
And for anyone who's in BC and has access to the surveys that are done through the school district, but the Early Development Institute or Indicator, the EDI, the MDI, the YDI, those also have, for children and youth, they have social connectedness indicators within the surveys.
That's great. With that, Jorge, can I hand the mic back to you?
Of course. Thank you, Jamie. So I'm going to be sharing my screen real quick, just for a couple of final announcements. I hope you're able to see my screen. So thank you again, Abigail and Shaina, for being with us today. Your work is truly inspiring, and we can't wait to see how the project evolves. We'll make sure to document the story and share it with the learning community. As a friendly reminder, we have our communities of practice, which I already mentioned earlier in the call. We have a call on April 30th, and this one is on community safety. And our guest speaker is Felix Munger, the Executive Director of the Canadian Center for Safer Communities. My colleague Sab Roop will be facilitating the conversation. I hope you can join us. We also, well, that's pretty much in terms of announcements for now, because I already shared a couple of them on the Strategy for Belonging working group. I really hope I can see you there. Again, the session, the first one will start on April 29th, and we will look at leadership as a foundation for belonging. The upcoming conversations will be on social infrastructure and belonging, policies, the policies that can enable belonging, and we'll wrap up towards the end of the year on terms of future directions. What are the future directions for the Strategy for Belonging as we head into 2026? So you can find all of the dates, all of the information, all of the agreements that we have set up in place for the Strategy for Belonging working group sessions through our website, which we will also share in a follow-up email. But for now, that's it. Thank you so much for joining us today. Again, my name is Jorge, and I hope I can see you next time. Please stay tuned for the next series on the belonging and climate action, which will be happening this summer. Take care.